Okay,
Here we go.
okay, let's call the Health and Human Services Board meeting to order.
Okay.
Carol.
Carol, he called us.
Oh, I'm sorry.
Oh, young lady.
Okay,
At least me.
we have the
I guess I
roll
should put everybody like
Dale
that.
Schweeder,
call here.
Reed Schuman,
Here.
Dale Olson. Dale Olson's here, Chuck Van Etten. Don Pettit,
Here.
Boucher, Jen Vabornik, Carol Pearson,
Yeah.
Sabrina Dunlap. We have 5 out of 9.
Okay,
Amen.
and certification of compliance with open meeting laws.
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay. Reading agenda. Any changes necessary?
I
Motion,
think it looks good, Mr. Chairman.
is that a motion?
That's a motion.
Second.
We have a second from Ms. Peterson. Everybody in favor, say aye.
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 The public comments. Anybody from the public like to speak? Public on the Zoom. Okay, and Lorraine is here. Okay. Lorraine, you want,
Do you want to do minutes?
I keep forgetting them.
It's way on the bottom.
Yeah. We have a motion to approve last month's meeting minutes.
Yep, just a second. Yeah, I've read them. Mr. Chairman, I'll approve them. Make a motion to approve them as presented, please.
Second. Carol, thank you. Everybody in favor, say aye.
Aye.
Okay, Lorraine, sorry about that, but you're on now. Not here? Well, I thought you said she was.
No, I don't see her on there, Mr. Chairman.
Okay, did you have anything, Dan?
No, I don't think so.
Okay.
Thank you.
Administration. Opioid settlement,
We have senior resource.
Senior Resource Center will not be here
They're not here.
tonight, but I can tell you that Joey just got back in the office. She's been cooking for 3 weeks because they're short staffed. So she's just now going back downstairs.
Okay, so moving on to the consideration of the opioid settlement proposal. Within the packet, you see the resolution that has been prepared for the settlement agreement. This is the lawsuit that was filed back in 2017. The county board authorized Sawyer County to participate in the litigation against 3 manufacturers and 1 distributor of opioids. I think about, is it 68 counties out of the 72 are in the lawsuit. There were 2 counties that did it on their own, did their own litigation, but we are part of the Wisconsin litigation. This is a nationwide lawsuit. Other states have also participated. This has been going on since 2017. The attorneys have been working on reaching a settlement agreement. The judge in Ohio has agreed to the settlement agreement. So what happens next is it goes up to all the states and all the participating entities. Wisconsin passed Wisconsin Act 57 earlier this year that allows for counties to get 70% of the allotment coming into Wisconsin, and the state keeps 30%. That's one of the most advantageous arrangements out of all the states. Some states haven't finalized their apportionment yet within their states. But Wisconsin was very proactive, and Wisconsin Counties Association was very proactive in getting that money funneled directly to the counties, because we are the ones who will have to deal with the crisis that has been created by these opioids. So at that point, the Wisconsin Attorney General needed to authorize the settlement, and he has done that. After that, each county got the paperwork that has been sent to you via email. That's a lot of information. A lot of different documents contained in that is the entire settlement agreement with the allocations. There's also Exhibit E that explains what we can use that money for. So that's another lengthy exhibit within the documents that we'll work through in order to spend the money appropriately to abate some of this opioid usage that is occurring and has occurred throughout the county. So the resolution in front of you is the same resolution that is going before every county within Wisconsin that has been also prepared by the attorneys that were representing us. They're looking to have 100% participation, which would allow us to get the money 100%. That means all the counties within Wisconsin to adopt this settlement agreement by January 4th. That's the deadline that we have. So it is important that if you do take action, that it does happen in December. And so that's why this is coming forward to you today. And I can entertain any questions you may have.
Anybody?
You said that there were 2 counties that opted out and did their own negotiation. Now, you just said that we need to be 100%. So are they coming in?
That would be 100% of those
involved.
participating
Okay,
within us,
thank
and then they have their own,
Okay.
they're kind of like their own state, or what, you know, it's Milwaukee County and I think one other county,
Okay.
one of the larger ones.
Questions online? Go ahead.
Anybody online? Good. Okay, I'll make a motion, Mr. Chairman, that we approve the resolution authorizing Sawyer County to enter into an engagement agreement to pursue litigation against certain manufacturers, distributors, and retailers of opioid pharmaceuticals.
I'll second.
Second from Dawn. Any further questions or discussion?
Yeah, then in discussion, Tom, line 97, where they talk about you can't commingle funds with the county's general fund. How are we gonna do that?
Yeah, so we'll set that up on the books. So this money does have to be segregated. And, you know, we track that separately, so that can't be used for general governmental services. It's got to be used for those items in Exhibit E in the documentation. So it'll be accounted for much like the ARPA funds, you know, where we've got a pile of money that is segregated that we have to spend for a specific purpose. And so that'll be tracked independently from anything else. We don't know the total amount at this point. It does depend on participation, not only from Wisconsin, but all the other states. But it does get a portion according to the formula that they've worked out and in this plan. It could be, I've seen a number like 700,000, but that comes over a number of years. I think the Johnson & Johnson settlement is over a 5-year period. The other settlement is over an 18-year period, but that may be front loaded so that we get more of the money sooner rather than later. So it's not like an equal amount every year, but we haven't seen exactly what those dollars are in each of the years, at least I haven't.
Does the money come directly to the county? And if so, how is it dispersed out? Like for the tribal entity to do their programming with the opioid programs that they're doing?
They have their own settlement.
I believe, yeah, the tribe also was in litigation
Oh, okay.
themselves. So the tribes
Okay.
get a pot of money,
Good.
the counties
Okay.
get a pot of money.
Still
So
done this.
Yep.
Yeah.
Okay.
We will spend our money to cover the whole
Right.
county.
Okay.
But I am hopeful because of our relationships that we'll be working programming together to make the
Oh,
best
yeah.
use of all our resources.
We have been, and I hope we continue to do so.
Okay.
Good point. Good point.
Okay, any other questions or concerns? Everybody in favor, say aye.
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 Motion passed. Long-term care. Well,
Hey, Lori Perlick submitted a report for your review. I want to highlight a couple things. One is Carol Martin, I was highlighted a couple months ago in October for good work. She was highlighted again here for creating a spreadsheet
Wow.
that the state's going to be using. And then we also have Hank Norris, he's our disability benefit specialist, and he was recognized by his program attorney for record keeping and how responsive he is to his clients.
I have a quick question. But they also noted that he has, the folks in the north have like double. the
Right. That's, yes.
caseload of
Yep.
people in the
Thank you for
south.
bringing that up.
That's, they're doing good work with fewer people. That's good.
Mr. Chairman, I got a question for Paul.
Yeah.
Paul, under Adult Protective Services, they have a guardianship policy draft. Is that something new? or
And
are we
thank you
changing
for
that?
bringing it up. We've been talking about that. Lori's been working closely with the attorney, and that'll be brought to next month's board meeting for your approval.
Can I ask what that means? I'm sorry.
The guardianship policy draft,
Yeah,
when you get it, it'll make more sense, but I can give you a rough overview.
okay.
That unit is getting inundated with requests to do guardianships. And
Oh.
Lori can explain this better than we can,
Okay.
but we have limitations in what we can do. So based upon our staffing level, we kind of want to just do what we have to do.
All right,
Because they just can't take on anymore.
got it.
So some of these entities, they really should be doing the guardianships themselves. And they do a Teflon slide over us. And so she worked closely with an attorney to set some limits on that.
Good, thank you.
Well, does the county have to be the guardian? Aren't there entities out there that are professional guardians?
There are, but I also want to qualify this. I'm not the expert in the guardianships, and Lori will be here next month to explain it. And that's what she worked with the attorney about. What do we have to do compared to the other entities?
Are we the,
We,
I would like to know if we're the guardian of first choice or last resort.
there's guidelines for that, and that'll be in
Okay,
the policy that you see.
thank you.
And I think some of it has to do with assets and income. And in fact, I know it does.
Probably, I believe so.
Okay, the next one is you have the behavioral health report submitted by Alicia D. Carlson. I'll highlight some things in her written report. One thing that's not in here, she talks about the northern region being up for certification. It went stellar, and we've got a 2-year certification. So in spite of all the convoluted rules and stuff, all the counties somehow pulled it off and passed review. Great.
Wonderful.
And I could say that Alicia led a lot of that charge on that. Let's see what else. The CST program, the new person that is running it, Melissa carefully, it's Allison Carlson and not Alicia Carlson. We have an Allison Carlson. And you really got, when the emails come, you really got to pay attention about where you're getting them from.
Yeah,
But Allison, they had their first, she chaired or ran her first Sawyer County coordinating meeting. And you were there, you were there 2 weeks.
yeah,
I watched it, yeah. So looked like it went
that
pretty
was a
well.
very interesting meeting. How often they have those?
Quarterly.
Quarterly.
Yep.
A lot of good people there representing a lot of different organizations.
Mhm. And then the CLTS program, Children's Long-Term Care Support Waiver, was plugging right along, and right now they got 45 consumers, they said, with 2 more referrals.
Mr. Chairman, I got a question for Paul. Paul, what's the deal with not being able to hire a mental health clinician? Is it that none are available, or we just don't have a competitive wage? What do you think?
I would think wage is part of it, but I think even if you had an enhanced wage, there's just a limited amount of people available to do these jobs.
Right.
But they talk about it hinders the program and the number of,
It doesn't,
consumers they have. And it's like-
it doesn't. You also got to remember that we've talked about this ad nauseum in here, but these other clinics around town, very few want to get involved in CCS because all the things you got to go through to get certified. And one of the things that Alicia's working on, and I think, Joe, you've been to some of those regional meetings and they got the state's attention, is that these people that are licensed clinical social workers or licensed professional counselors or psychologists, whatever you have, what have you, they have to go through this extra certification, which is ridiculous. Why would you go through all that licensure with the state and then have to do this again? And I think it's a turnoff for a lot of people, and they just don't want to get engaged in this. And we have reached out and reached out and reached out.
Is there any way to get that waived?
Well, that's what they're working on. And if you remember,
Alicia changed.
Alicia helped did this thing with the licensed marriage and family therapists,
Right,
where they weren't allowed to do diagnosis, which is absurd.
right.
And they were able to work towards, they got that changed. So they're doing something similar. If you remember, she was in here a couple months ago and said that she's kind of on a hot streak now and hopes she can still continue on that and make that change. But as you know, those kinds of things take a lot of time.
Yeah.
But I haven't heard anybody that's in this field that is not in agreement with that. And I, for the life of me, don't know who wrote that and why they wrote it like that. It's just absurd. Okay, you also have your regular report from Cindy Hannes on the mental health cost by client report. And then we also have a written report from Joe Bodo, our behavioral health coordinator. I want to highlight a few things in there. He's talking about placements, and we're continuing to having a number of people that have high needs, mental health high needs, that are going to probably going to require replacements. And he even mentioned it, we've got some people moving from out of county into Sora County that are going to have some of these high needs and might end up needing some high cost placements, which couldn't.
Why are they moving to some?
I don't. It's their freedom to move wherever they want. You can't stop them.
So we're enticing them to move here.
I don't know. I have no idea. I don't know.
Okay, thank you. I'm just curious.
I don't.
But Tom, it's allowable now to borrow for court-ordered out-of-county placements. Is that true?
There is a statute that allows for court-ordered, I forget the wording, but something that is court-ordered can be levied for outside the levy limits.
Okay.
Does it apply to out-of-county placements? Perhaps.
So is that something we have to look at down the road, or because our fund balance will be
Yeah, I mean, so, yeah, this year and last year, we accommodated it with fund balance, and we still have a
Right.
healthy fund balance in the general fund. Not so much in the Health and Human Service Fund. We'll have to, transfer that money into the Health and Human Service Fund. But yeah, I mean, that's one of the options that we had kind of talked about before, and it can be put on the table at any time. But, for 2022, we've got it accommodated within the budget, unless it goes real lot.
So at Northwest Regional Planning, I meet with all the county board chairs in this whole northern region. And I always bring that up, and very few have this problem. Like some, like Washburn County. I said, well, we rarely have out of county placements.
Well,
So
that's interesting you say that, because at the Wisconsin County Human Services Association board meeting this week, or last week, they're getting ready for the next budget.
Yeah.
And they always pick like a topic that's gonna be real important. Like a few years ago was CPS. It's mental health. And it's the mental health crisis costs and the placement costs. And they were talking about WCA and WICSA is going to be working with, there's an agreement with the county administrators, the county execs throughout the state, and especially your group, that there's agreement to work with WIXA. And so they're going to start planning about what, what are they going to go for and how are they going to formulate, what are they going to advocate for? So there's movement on this. There may be some counties that don't have as much placement, but I'm telling you, I'm in these meetings and they're all complaining about it. And that was a huge topic again at the WIXA board meeting last Thursday.
And is it their legislative? Something?
Yeah, I
coming
mean,
through
this
right
is
now?
the legislative process and it's a slow moving process, but your group, the WIXA group, the Wisconsin Counties Association are all behind us now, are going to be working together and, talking to the legislators about what kind of legislation could possibly pass. I mean, there's a lot of things, pie in the sky ideas, but what can they get through that would help counties such as us? So that is an effort that is at the top of the list going into the next budget season for the state, which is, 2 years, but they start that discussion now.
And related to the population we're just talking about, our CSP program run by Northland Council, we have Carol Lund here tonight. They're up there to nearly 60 clients and they only have so much staff capacity there. And then of course with transitions too. And also Joe noted that there's, I guess the Sheriff's Department contracted with an organization called Talon, is that how you say it?
Talon.
And I don't know what they're using them to do transports now, what that cost would be, if it's history repeats itself, that cost will be passed on to Health and Human Services. We don't know what it's going to be. And I also we were talking about that opiate settlement. Joe made a comment on here that he's just he's used the term barraged by numerous families looking for help with that issue. And he's noticed a lot of the overdoses that have been going on lately in the county. And he's advocating, and I guess he's brought this up to some people at certain times about having some kind of task force or whatever to talk about, how are we going to work on this? And I'm assuming, Joe, you're talking about, some partnership between the county and the tribe and whoever else wants to be involved. And I think when that settlement comes through, I think the sooner we start talking about it, but what we want to do, the better off we're going to be. But I think I think Joe's advocating, the sooner we have those conversations, the better off we're going to be. And I've talked to him one-on-one about it, and he's really concerned about what's going on.
And the reality is we partnered successfully with the tribe in the past. And I think, it would be smart for us to start looking at how we could do that in the future to offset this epidemic with this opiate use. It's real disheartening. I think I mentioned it to Tweed, when you get an elderly person, my age older, and they can't enjoy their time because they're worried about their children. They're calling. I had 2 calls this week already on families that want to commit somebody because they are using drugs. I mean, average 1 a week at least, if not 2 on some weeks. So when you think about that, we have 60 some people on CSP, a percentage of those get hospitalized in crisis in Winnebago. Carol does the CSP up in Bayfield County. How many in Bayfield County about, Carol, on CSP? 12. We don't know why, we have this percentage of people with that significant mental illness, but we have a lot of things going on here. And the more we go ahead and we keep getting more people in here, we have to build in something for helping these folks. And I think this is what the challenge is going to be. And I've mentioned this before. Tweed, you were at that meeting when they were talking about bringing more public housing in here. They want to build little communities and get little houses and little, like shelters for families that come in. But when you get families that come in, and if they're low income, there's a percentage that have health issues, correct? Because, the money's not there. There's a percentage with mental health. There's a percentage with that. And when it can't be funded, it comes to us. We've been, mental health has been, we're like being the single greatest entity of trying to help people. When a kid's making a threat to shoot up the school, they're calling me, they're calling somebody. What can you do? And you see how it works, So I just think we need to talk about some of this stuff before it's too late and develop a plan. And a task force would be a great thing.
Joe, when did that
Excuse me,
get started? I'm
excuse
sorry.
me, Carol. Thank you, Joe, but in the future, please wait to be recognized before you start talking.
I'm sorry.
Okay. Go ahead, Carol.
Carol speaking, directing the question at Joe. If we have direction for when the opioid money comes, such as the task force, and it splinters off into different agencies, I think that's a good starting point with the direction of, what did you call it, E? The E, where it has to be spent.
Exhibit E within the settlement document
Right.
explains, yeah.
So have you looked at that, the settlement document, to see where their expectations are for the money to be funneled?
I'm not familiar with it. No, I haven't.
Okay, could that be shared so that we could get some direction when the money comes, that we have some
Absolutely.
things going? Thank
Yes.
you.
Mr. Chairman, we really need to, Joe, and I appreciate you bringing that up because, you know, our little funeral home out there on the reservation is beyond busy. I mean, we are, and we have young people that are going through there, like Joe mentioned, weekly. And, you know, the most recent young lady was just recently, she was part of our healing and wellness court and program, and we had just spoken with her, and then she had just been released from jail. And within 48 hours, you know, she's at the funeral home. So it's just such a huge problem, and all these young people and their parents, and these are mothers and dads, young mothers and dads that leave families, and everybody just heartbroken. And so we really need to do something. And these treatment facilities are a long ways away, hard to get to, hard to fund. There's a waiting list to get them in there. And when these people reach out for help, you got to act. And you've got to remove every barrier, open every door, and get them in and work with them. And it's like a mini step process, because they're gonna fall off on their way to recovery. So we got to be ready for that. And I think using this opioid money, Tom, for something, you know, that we can jointly do between the tribe and the county, a treatment center, maybe a place where these people can go to be with other people that are sober and explain their situation and get help. We have to do something, because what's going on right now is not working. And, you know, I talked to Sheriff Morotek because the recent law enforcement agreement that we agreed upon now is a drug task force. Tribe and the county working together and trying to reach out to these people and get these dealers out of here. But, you know, we're not going to arrest our way out of this. So somehow we got to come up with a community program where these people can reach out and get help. But like I said, what we're doing right now is not working.
I happened to speak to Jamie last week because I was out there. Jamie runs Pineview Funeral Home, and he's working 80 hours and more, and he can't get relief or help. And he said he's not the only funeral home dealing with this barrage of young people. And it's just overwhelming. And, you know, I can't understand why there aren't safe houses, treatment houses, something where, but I've asked a lot of different people that are in the field, and because of COVID, it is a big problem. The people that have these addiction problems or these serious crisis problems, they're reaching out to Sawyer County or maybe a therapist or something, but they can only do it through a phone or through the internet or something like that. And because they can't have their meetings, they can't have their social structure, so to speak, where they can talk to another human being. So I just don't see how it can work. You know, years ago there was NAAA and all those organizations, and those people could gather and support one another. They can't do that now. So that's why it's hitting us. And people with those type of problems, they slide backwards without that support. And they fall off the cliff. So I don't know what the answer could be. And it's even with the seniors, the isolation that they're affecting, the mental health among the seniors is really stepping up too. And I think that's why we're looking at all this guardianship stuff. We're in crisis. We're in crisis. And we got to come up with some answers. I'm sorry.
No, we're trying.
The next one you have, actually, forgot the new title is going to be Children, Youth and Family Services. I don't think I told you that. But underneath there we have the CPS report, you have the caseload count, and you have, oh no, we're not going to do it that way, excuse me. Anyway, you got the CPS reports here, and you got the substitute care report. And then the same thing for youth justice, you have their report, the caseload. I want to tell you about the staffing. We were able to hire a new social services aide, and she just started today. We interviewed a couple of people for those 2 open positions on the Children, Youth and Family Services unit, but we haven't been able to secure anybody at this point. So there's still 2 openings, and they're just it's stressful.
Yeah.
And I can tell you, we also, on that WIXA meeting last week, I also talked about, I mean, as we have for ad nauseum again, about recruitment and retention of staff. They're just not there for whatever reason.
Paul, have we seen anything since closing Oasis that concerns you, or anything that may alert you?
No.
No.
No. Do you have something in mind?
No, I'm just wondering, since we closed it, are there any referrals that have to go elsewhere, or what are we doing with our youth?
I'm sure there's some, but keep in mind that Surrey County did not populate Oasis. So. And then you have your economic support report, and it's steady as she goes there. They're plugging along, and the processing rates are in the upper 90s. Doing well. Then we have public health, and I'll let Julia take it over. She has a written report in addition to COVID this month.
Yeah. I just got an update on WIC, and our services are still moving along. One thing is we are, because we're under the Federal Emergency Act, we do not have to see, or people do not have to come in person. That's part of how WIC has been run for over a year. And so we are doing everything via phone, hoping to get back into meeting in person soon. And we have a remodeled WIC room that's brought together so you can do all your services in one room. So we're excited for that, and I'll bring pictures when we're able to get that up and running. And then I did, it was the W's today. So WIC and water. So, and our water testing program is going strong, and I wanted to share that as well. So does anybody have any questions on that? Okay, and I'm up, right? Okay. Well, things are not a whole lot different than they have been from the last couple of months. We still have high cases. We're down at a little bit lower now as we're looking at the thing. Hey, Mike, can you move Dawn out of the graph, just so that everybody here can see? And you can see that it dropped down a little bit. We did have update to our electronic system where all of our information comes into, and the data is coming in fairly slow. So it might be, that number might be a little bit lower than what it actually is, as we can see. The other thing is since we met last month, we have exceeded over 3,000 cases. Community transmission is still high. Positivity rate is at 20%. We would like to see that getting low. And what that really means is, of all the tests that we're doing, it's the number of tests that come out positive. We like to get that down to, it would be nice to get down to the moderate range again. And then I just wanted to give a picture of what the CDC has for where things are in the United States. And then I did put a picture of from the World Health Organization just to show where things are at across the world. Age distribution of cases. We did start with this last month. This is preliminary data for November. Usually I need until at least the 15th of the month for that data to finalize, but just kind of gives you a little bit of an overview. We are seeing over the month of November that 0 to 9 cases were higher. The 10 to 19-year-olds dropped down. So we kind of got through the bulk of those still higher. And then you can kind of see where the 30-year-olds to 60-year range is fairly high. So, and November cases did outbeat October cases. So one of the things that happens when your case rate gets high is your hospitals get impacted. They tend to see the delay. Case rates go up and then we start to see the hospitalizations. So what I did receive from the hospital is the acuity means the amount of care or how sick the patients are is remaining very high. They are 2.5 times higher in their census than they were in 2020. 50% of the patients are COVID, and they do require intensive care, meaning that they're needing a lot of respiratory support. The amount of support that we're giving these patients, typically we would be transferring them out to a higher level of care. So, and what is on here, there's some big words in this report, tertiary centers, where we'd be sending them to Eau Claire or Duluth or to the cities. So we're keeping the patients there. The other thing that we're seeing, and this is at our hospital as well as other hospitals, is what we call boarding in the emergency room, meaning we've diagnosed the person, we've decided that they need to be in a hospital bed, but there's no bed. So we're caring for them in the emergency room until we can either find a bed someplace else or get a bed opened up somewhere in the hospital. So, and that's what the traditional care delivery model, that accommodation means, that we're kind of changing some things around to meet people's needs. And again, hard to transfer patients out unless they're extremely critical and need to be life flighted out. Yes.
Julie, does that mean that rural hospitals then are keeping people that really they should be transferred out to a higher level of care?
Yes, that we would have typically transferred out to a higher level of care. So this is putting a lot of stress on the staff. They are at full census. Typically they're managed for 8 and they're at 20, and 50% of those patients are COVID patients who are pretty intense patients. So yes, so we're pushing their limits, and the staff, I'm sure, are very stressed. They're having to work lots of extra hours. Leadership is working on the floor just to get everything covered. So,
and this is pertaining to the Delta variant, right? We haven't even seen that. Did you say?
It is. This is all Delta that is happening right now. Yes. So it is not Omicron. Yeah.
Well, I'll share it. We had COVID. My son went to hunting camp and contracted it and told him to stay up there. He came home at the tail end of it. I sent him out to the emergency room. He got tested, but he talked to a lot of there were 40 guys up there, and most of them got it. But they did the self-testing and didn't report to anybody.
Yeah.
So I'm wondering about all those numbers. And when I sent my grandson over to Walgreens to get a kit, they were completely out.
Mm-hmm.
And so people aren't even tested, but they know they've got it.
Mm-hmm.
So these numbers are, forget it.
And that's very true. We're estimating, and this is just a sheer guess, that maybe 50%.
I would say 40 or 30.
Yeah, that
from
we
what I
even
experienced.
know about. So
right.
yeah, so we deal with phone calls on I tested positive at home on a home test, and we're trying to work through those. Our staff is pretty tapped out too. We are not getting to all of the cases that we should be getting to either.
Right.
So just where everybody's trying to do the best they can, and people
I'm
do
not
want to stay home.
criticizing,
No, but even people like home testing, they want to know what they have, and then most people are trying to stay home or protect people, or like, you know, your son call you, Mom, guess what? So the other thing that this is a very complex looking diagram, and I apologize for that. I was having a hard time getting this long one to come up again. And been trying to show from month to month what's really happening. And so I just pulled up September and October so that we could see kind of what's happening. It's about the same amount of cases who are unvaccinated, where we're seeing cases. So in September, there were 513 of vaccinated. In October, there were 456 per 100,000 that were vaccinated. And then you can see the hospitalizations and the deaths. What we definitely are seeing is there's a greater amount of people who have not been vaccinated who are getting COVID, and it does cause more hospitalizations. We are seeing that locally as well. Those numbers are playing out. So since the rise in cases in October and the hospitalizations that started, since then, the majority of the patients have been unvaccinated. There are patients who are vaccinated who do have breakthrough. We know that some people get hospitalized, but the majority are unvaccinated. The other piece of this that the hospital reported is November of their COVID for months of COVID. No, this last November was the highest amount of COVID patients that they've ever had in the hospital. So they definitely are getting hit hard. And the other thing that they're seeing is that the age of patients are younger. It used to be when we were first reporting out hospitalizations, people were 65 and older. We would say a lot of comorbidities and different things, but we definitely are seeing quite a number of patients that are under age 60 who are being hospitalized. And that's not just here, that's all around everywhere. So concerning. Getting onto those variants there, Tweed. So Delta is the main one. That's what we're seeing across across the United States. But Omicron is coming in, and people have been asking questions about this. At this point, we don't want to get overly excited about it. We just know that it was quickly identified and considered a variant of concern. The United States moved it in that direction, and then we had our first case in the United States on December 1st that was confirmed. You can see the cases, the states that are the dark green are the ones that have had it identified in. What I can tell you about Wisconsin is there was a wedding that took place in the southern part of the state. A number of people had come in from traveling. There were some cold-like symptoms, went in to be tested. They knew that they had been traveling, so they did go ahead and do that sequencing, and we have determined that that it was there. We don't know that it has spread any further amongst everyone.
Julie, do you know what the symptomatic things are different between the variations of the?
At this point, we do not know that we do not see any of the differences in how people represent what we're knowing, and we don't even know if it's going to spread any easier than Delta, but we do believe it has spreading easier than what the original SARS was. So it could be about the same. The other thing is we don't know if it could make people more ill or not. We haven't had enough time to really look at this. The other thing is the questions on vaccines working. We believe, based on just past experience with the other variants, is that the vaccine will continue to work about the same as it does with Delta, meaning there will be breakthrough cases, but less of the hospitalization and deaths occurring. And then they still don't know about treatments with Omicron, whether some of the different treatments will be impacted or not. One thing that I did not put in my report, I just dawned on when I was talking about treatments, is that there was an emergency use authorization put in place on a new oral drug that would be similar to how Tamiflu would work. Like you find out that you're sick, and you with influenza, and then you can start taking some medication, an antiviral. There is a new one that has been approved, very limited amount that can be distributed at this time. I'm not even sure where it will be. I know it will be available up in this area, but we haven't found out who is going to have it. But that will be a game changer for us as that becomes more available.
Sure. The vaccine,
Yes.
have we found that has it proven to be as safe as they anticipated, or has it wavered at all from that? What is your
As
opinion?
far as getting the vaccine or as far as protecting against? Like,
Protecting against.
so.
You know, they developed it so quickly and they
Oh,
put it on the market as
yeah.
fast as
Yep.
they could.
Yep.
And people were apprehensive to get the vaccine because it was so new and untested. What is the jury?
Yeah,
on?
and what they're seeing is that, you know, there are some side effects that some people are getting. So you will hear about with some of the younger, like teenagers, we had some people that had the inflammation around the heart. That goes away. It kind of inflames. The other thing that we've seen is lymph nodes can get more inflamed, but then that goes away as well. It's kind of a short-term effect of your body working. Long-term, no, we are not seeing any issues with any of the vaccines. Now, as far as long-term, how long do they last? That we have to keep
Right.
watching for. And that is why anybody 18 or older who has been more than 6 months from their primary series should get vaccinated now. The people that have had breakthrough, a lot of the breakthroughs have been greater than 6 months from the time that they had their original series. I happen to be one of them. When I got it, I was 9 months out from my original series. So.
So it's very important to get that booster at the time frame.
And keep your immunity going.
Mhm.
Any other questions on that piece of it? Otherwise, going into testing, and Mr. Olson, I have this for you. I have numbers on the number of tests that we've done in October and November. So our testing site opened on October 14th. We're open Monday through Friday by appointment. And in October, we saw 126 patients were tested, which was an average of 10 per day on our testing days. November, we saw 561 patients and an average of 30 per day. We're definitely seeing people come in and using the resource.
That's good.
I just did it a little bit easier today. I cut and pasted from the site. This is from DHS, and it's just looking at 55% of everybody in Sawyer County has had at least one dose of vaccine. They will be getting us the 5 to 11-year-olds, but they don't have that data pulled yet. So hopefully by next month, they'll be able to give you some numbers on that. I know that LCO has been doing a great amount of vaccines. I think pushing over 100 on Wednesdays when they do the vaccine clinics. We are not seeing quite as many. We're probably 50 to 60, and it seems to be dropping down. Earlier in this year, or in the fall, we were like 80 some per clinic. So this is when the testing site or testing vaccine, or excuse me, not testing, vaccine clinics are. LCO and Sawyer County, we've just combined together so that everybody knows when our vaccine clinics are. Trying to get that out so that anybody who wants to gets vaccinated, they can. That's it. That's the end of my report.
Thank you.
Wow, very good.
Any other questions?
I guess this is for both of you too, Tom and Julie. Is there a vaccine mandate coming? Is that what I'm hearing, like a federal?
Well, there was a mandate put out, and that is now on hold pending some litigation. So we are waiting to see what's going to happen with that. Do you have further information
Nope,
there?
we're just settled into that we would have fallen into the 100+ employer.
Sure.
Even with that was falling under OSHA, and we would have been DSPS, so it would have been a little bit different.
Yeah, so Wisconsin public employees aren't under the OSHA, we're under DSPS. So it wouldn't affect all of our employees, but we are concerned about like public health and, ambulance service. Those that enter facilities that require masks, that we're still looking into how that would affect depending on what happened with the litigation.
Right. And then Julie, how is this impacting the budget? I know through 2020, we got some extra COVID money right throughout the year. Is 2021, did we get any extra money? or
Yeah.
how-
We did get extra money and we were anticipating that that was going to go farther than it would, but we've had a lot more with the contact tracing, the testing and the vaccines. We were expecting really COVID to no more contact tracing to be happening right now. So that has added. So Patty and I actually need to kind of sit down to see how much farther this particular fund package is going to get us. So I am looking also at, there are a couple other grants that I'm trying to apply for and get my hands on. So we'll see what we can do with some of those as well. We have been really sharing resources with LCO, have had some support with some contact tracing, definitely. Sharing vaccines, sharing testing supplies. So we are doing that as much as we can, sharing some of that funding. But the direct funding for paying our staff can't come off of the money that the tribe has. So.
Okay. Moving on. Those reports, everybody got those in their packets, I assume. The foreman's purchasers. Any questions, concerns? Okay, future agenda items.
I guess since we closed Oasis Comp, what is gonna happen to that other half of the building? Is that going to Public Works or?
I think that was on Public Works agenda. It's being occupied currently, being very useful.
I haven't.
Is that a good
And we
use of it
did,
then?
pardon me?
Is that a good use of it then?
I think
mean,
we'll make
obviously.
use of it somehow. I depending on what Public Works thinks, but I don't anticipate not using that building for purposes that
Right.
we can provide. Yep.
I can tell you, oops, sorry, speaking of, sorry. I can tell you that our staff is really pleased when it comes to testing and it's really cold to actually be able to get in and out of that very easily instead of from here going up and down the stairs and trying to go out and do all the testing. So it has worked out very slick for that.
That's good to know.
Okay. Correspondence.
Dawn
reports.
has her hand up.
Who?
Dawn.
Dawn, go ahead.
I don't think she heard you.
Regarding that building, especially with the opioid crisis and the need for rehabilitation services and some other things within the county regarding the drug issue, that we would maintain that building within HHS because we're going to need it. And we should not be getting rid of anything out of HHS that is that we have been using at this moment. Because as Joe said, we are in need of a task force. The task force we're way behind the 8 ball. And we need to get something done quickly because it's just spiraling down and down and down further. Individuals need great help. The families need great help. Out at the college, we've been affected, as Tweed knows. There's families now that are raising grandchildren and they're in their 60s, like Tweed said, and they're supposed to be enjoying their lives, looking at retirement. That is not going to happen for these families. They're now taking care of grandchildren or they're taking care of children that had taken something and now are not able to care for themselves. So they're now caring for an adult child as well. Unfortunately, COVID funding or opiate epidemic funding, and not epidemic, but the funding for it is not going to be able to give those families money because this is going to be, these children are young, their grandchildren are young. So we need to maintain that facility, that building for use. We need to get something in place or we're going to continue. The number is going to go up. It's not going to be 1 or 2 a week. It's going to be 5, 10. We need to get the drugs stopped coming in and something has to happen.
Okay.
That's all I have.
Yeah, that item is on the Public Works agenda for tomorrow, and Ms. Pettit is on that committee, so I'm sure she will be advocating for keeping the building around. So
Good.
Yeah. Any other comments, questions, concerns?
Just wondering, Mr. Chairman, if Julia would like to come to our county board meeting next week and give an excellent report, which you did tonight.
Sure.
Adjourn.
I looked
Sign
at-
the
I looked at the
resolution.
We're
MOU.
gonna be in the agenda.
There's a binary.
I was-
But I also want to talk
I
about.
asked her where she wants